Hello and welcome back to MediFriend. Today we are going to go deeper into a very important heart condition called hypertrophic cardiomyopathy, a disease that can be silent for years, but if ignored, can become very serious. I want you to imagine your heart for a moment. Your heart is a muscular pump. Every second of your life it squeezes and relaxes, pushing blood filled with oxygen to your brain, your kidneys, your muscles, and every single cell in your body. It does this without rest. It does this without complaint. Now imagine if that muscle becomes too thick. That is what happens in hypertrophic cardiomyopathy, often called HCM. In this condition, the heart muscle becomes abnormally thick, especially the wall between the two lower chambers called the septum. This thickening is not because of exercise or healthy muscle growth. It is abnormal thickening due to changes inside the heart muscle cells themselves. When the heart muscle becomes too thick, several problems can happen. First, the inside space of the heart becomes smaller. This means less blood can fill into the heart before it pumps. Second, the thickened muscle becomes stiff. A stiff heart does not relax properly. If it cannot relax, it cannot fill properly. If it cannot fill properly, it cannot pump enough blood to the body. Third, in many patients, the thickened septum can block the flow of blood leaving the heart. This is called obstructive hypertrophic cardiomyopathy. When there is obstruction, the heart has to push much harder to get blood out, increasing pressure inside the heart. Now let's talk about why this happens. In most cases, hypertrophic cardiomyopathy is genetic. It is caused by mutations in genes that control the proteins responsible for heart muscle contraction. Because of this genetic mutation, the heart muscle cells grow in an abnormal way. They become disorganized and thicker than normal. This condition often runs in families. If one parent has it, there is about a 50% chance that a child may inherit the gene. That is why family screening is extremely important. Sometimes, people do not know they carry the gene until symptoms appear, or until a routine test detects the thickened muscle. Now let's talk about symptoms in more detail. Some people may live their entire lives without symptoms. They may discover it by accident during a medical checkup. But in others, symptoms can develop gradually. Shortness of breath is very common. This happens because the heart is not filling properly, and pressure builds up in the lungs. Chest pain can occur even if the coronary arteries are normal. The thickened muscle requires more oxygen, and sometimes it does not receive enough. Palpitations are also common. Patients may feel their heart racing, pounding, or skipping beats. This happens because the abnormal muscle structure can disturb the heart's electrical system, causing arrhythmias. Dizziness and fainting are very important warning signs. Fainting during physical activity is especially concerning because it can indicate that blood flow to the brain is temporarily reduced. In some cases, the first sign can unfortunately be sudden cardiac arrest. This is why hypertrophic cardiomyopathy is sometimes associated with sudden collapse in young athletes. It is important to understand that this outcome is rare, but the risk exists, especially in high-risk individuals. Now let's discuss how doctors evaluate and diagnose this condition. The most important diagnostic test is the echocardiogram. This ultrasound of the heart shows the thickness of the heart walls and whether there is obstruction to blood flow. An electrocardiogram, or ECG, can show electrical abnormalities. A cardiac MRI provides a very detailed image of the heart muscle and can detect areas of scarring. Doctors may also recommend a Holter monitor, which records heart rhythm over 24 to 48 hours to detect abnormal rhythms. If there is a strong family history, genetic testing may be recommended. Family members may also be screened with echocardiograms. Now let's go deeper into treatment. The goal of treatment is not only to reduce symptoms, but also to reduce the risk of complications such as heart failure or sudden cardiac arrest. Medications are usually the first step. Beta blockers are commonly prescribed. They slow the heart rate and allow more time for the heart to fill with blood. They also reduce chest pain and improve symptoms. Calcium channel blockers may also help relax the heart muscle. If patients have arrhythmias, antiarrhythmic medications may be used. For patients at high risk of sudden cardiac death, an implantable cardioverter defibrillator, or ICD, may be recommended. This small device is placed under the skin and monitors the heart rhythm continuously. If a dangerous rhythm occurs, it delivers a shock to restore normal rhythm. In patients with severe obstruction and persistent symptoms, despite medications, surgical treatment may be necessary. Septal myectomy is a surgery in which the surgeon removes part of the thickened septum to improve blood flow. Another less invasive option is alcohol septal ablation. In this procedure, alcohol is injected into a small artery that supplies the thickened area, causing it to shrink. Now let's talk about lifestyle management. Patients are often advised to avoid intense competitive sports, especially high-intensity or burst-type exercises. However, mild to moderate physical activity may still be allowed under medical supervision. Staying hydrated is important because dehydration can worsen obstruction. Avoiding excessive alcohol is recommended. Regular follow-up with a cardiologist is extremely important to monitor changes over time. It is also important to manage blood pressure and other heart risk factors. Emotionally, being diagnosed with hypertrophic cardiomyopathy can be stressful. Many patients feel anxiety, especially if they hear about sudden cardiac death. But it is important to remember that with proper monitoring, risk assessment, and modern treatment, many people with HCM live long, productive lives. Early detection is the key. If you have a family history of this condition, unexplained fainting, or sudden cardiac death in a relative under 50 years old, you should get evaluated. If you experience chest pain, shortness of breath, or palpitations, do not ignore these symptoms. Your heart may be trying to tell you something. Hypertrophic cardiomyopathy is serious, but it is manageable. With awareness, early diagnosis, and the right treatment plan, patients can live safely and confidently. Your heart works every second of your life. Give it attention, give it care, and never ignore warning signs. Thank you for watching MediFriend. Stay informed, stay healthy, and protect your heart.